Kano Diagnostic Assessment Project. Operational data within the context of primary and secondary health systems has the potential to generate insights that can support performance management and strategic planning for policy making, especially as it relates to understanding the scale and structure of health outcomes in delivering last-mile impact at the facility level. The Diagnostic Review is a state-inclusive assessment focused on ensuring state ownership in planning, designing, and deploying the assessment toolkits to determine how operational data can be used to answer performance management questions across the input to outcome continuums. The assessment's main objective is to evaluate the PHC data ecosystem in Kano State, including understanding existing data sources, their applicability, governance models, collection processes, management practices, and data utilization for evidence-based decision-making. Process roadmap for the operational data diagnostic reviews and assessment. The process roadmap provides a stepwise chronological order for the diagnostic assessment. A key driver of success for the assessment was ensuring state inclusion as part of the planning and analysis processes. Team composition. A team of seasoned experts were selected for this assignment, with a strategic health policy advisor engaged in coordinating and providing policy perspectives and direction for the assessment from 5 other core subject matter experts focusing on human resources for health, supply chain management, healthcare financing, service availability and readiness, and data management domains. The structure of the engagement team is further provided in the organogram as shown. Stage 1. HREC approval. The assessment kick-started with an application for HREC approval from the Health Research Ethical Committee (HREC) to ensure that the assessment meets the ethical and scientific standards required to conduct an assessment in the state and is in the state's best interest. HREC approval was received from the State Ministry of Health as shown. Stage 2. Planning stakeholders' entry meetings to agree on deliverables and assessment frames. The entry meetings provided the opportunity to engage with the state health ecosystem leadership to introduce the objectives of the reviews and expected deliverables and assessment frames for existing desk reviews across the 5 domain areas the assessment team was to cover. The entry meetings also provided an opportunity to discuss the coordination framework and how to implement an inclusive assessment. Stage 3. Desk reviews on existing literature across the 5 domain areas and preparation of questionnaire. As part of the assessment process, the desk review stage focused on reviewing existing studies and assessments in Kano across the 5 domain areas to understand the structure, institutional arrangements, and operational data archetypes. A total of 51 study materials and assessments were reviewed based on the following components. 1. Governance and institutional frameworks across each of the domain areas. 2. Understanding operational data archetypes. 3. Understanding how operational data supports performance management. 4. Identifying gaps and opportunities to improve the use and uptake of operational data. Furthermore, a political economy analysis was done to determine the appetite for reforms and improvement around the use of operational data. This includes the review of questionnaires to support clarifying the state of play across the 5 domain areas. Study materials used as part of the assessment were selected from the 5 domains of 1. Human resource for health. 2. Service availability and readiness. 3. Healthcare financing. 4. Supply chain management. And 5. Data management. Upon completion of the desk review, a preliminary briefing report including questionnaires for each domain was developed as a guiding frame for the FGD K2 session with the Kano State team across top, mid, and lower levels cadres to update the current state of play. Stage 4. Focus group discussions and key informant interviews to validate the findings of the desk reviews and update the state of play. The FGD K2 session was a 3-day validation session carried out by the sector experts to validate findings from existing desk reviews. The session was designed to gain additional insights into the desk reviews and update the assessment report into a final landscape assessment report. The questionnaires were deployed to various levels of stakeholders within the health ecosystems: the SMOH, KPHCMB, DMCSA, KET Fund, KACHMA, and KSBS. The stakeholders include low-level program officers, PHC coordinators at zonal and local government area levels, mid-level deputy directors, senior program officers, and top-level directors, executive secretaries, commissioners, deputy governors, etc. The FGD-K2 provided an opportunity to further understand the current gaps, prioritize focus areas with stakeholders related to performance management, and change management considerations that need to be in place to achieve sustainability. Upon the completion of the FGD-K2 sessions, a maturity gradient was developed that scores the state across the 5 domain areas. This was also used to identify gaps and process improvement plans that can drive incremental improvements in the use of operational data. Stage 5. Field assessment of 44 PHCs to determine alignment between state and facility level workflows. The field assessment stage collected facility level information across 44 PHCs, 1 per local government area, to assess how operational data at the facility level are used at the facility, local government areas, zonal and state levels. The field assessment assessed facility-level operational data sets to understand the types of data collected and generated, process workflows and reports generated at the facility level, and how they can be aggregated to form state-level perspectives. A facility selection criteria focusing on randomly selecting 44 facilities from a pool of 188 facilities with the displayed selection criteria were selected. Stage 6. Process review workshop to further deep dive into the state of play for operational archetypes. The process review workshop was designed as a 3-day boarding session focused on deep diving into the operational data archetypes identified during the desk reviews and FGD-K2 sessions to understand the process workflows and reporting checklist achieved through existing operational data. The process review workshop successfully identified how data moves vertically from the facility level to the policy level for decision making and horizontally from planning strategy to the implementation stage at the state level. A schematic and a diagrammatic workflow was designed and validated with the stakeholders present during the sessions. Stage 7. Mapping of operational data to determine performance management continuums across the SSHDP and BMGF BO. The performance management mapping exercise was a 2-day boarding session designed to map performance management across the inputs to outcome continuums, which can be used to answer strategic questions from the State Health Development Plan. The session was well attended by stakeholders from the 5 domain areas, culminating in a validation session which focused on identifying key performance questions that can be answered by the assessment. Stage 8. Finalizing and harmonizing operational data across the 5 domain areas. In Stage 8, the assessment team, led by the Strategic Health Policy Advisor and sector experts, deliberated on the report and harmonized position regarding the identification of gaps in the use of operational data, identifying process improvement plans that must be achieved for the use and uptake of operational data to generate insights, and agreeing on performance management mappings that can be generated from existing operational data archetypes. Stage 9. Validation of diagnostic review and assessment reports. Finally, the report's findings were shared with the state teams in 2 validation sessions, one in Kano and one in Abuja, to further scrutinize the report and solicit contributions to enrich the report prior to its finalization and